In 2014 to 2015, a project funded by the Italian Corporation through IOM MEDE program and implemented by the Inter-University Research Center for Sustainable Development in Rome have been developed in Somaliland. The project aimed at improving health of women and their children from the poorest and most excluded groups in 4 areas with more than 100,000 inhabitants in Hargeisa town. The objectives and activities are described by Dr. Khadija Ali Mahmoud, project coordinator, in her opening speech. In spite of many efforts, a lot of work remains to be done in our health system, and our population have not an access to a qualified healthcare delivery system. This project that we wanted to do, or our project today, wishes to improve and contribute health centers' reception, performance, especially of those dedicated to offering health services to women and their children. In this first project, and we hope there will be others in the near future, we start selecting 4 important areas of Hargeisa. These areas are where the people who are more in need lives. They are Muhammad Moge, Sheikh Noor, Dr. Sahardit MCH, and Dami. This doesn't mean that we are going to work only for these 4 MCH. Hargeisa have got about 12 or 13 maternal and child health centers. So our aim is to include everyone and every MCH. But this project is a pilot project, and we will be trying to understand how our actions need to be oriented. We would like to succeed in reaching the following objectives, central to improve the quality of healthcare delivered, to reduce maternal morbidity and mortality, to reduce neonatal and child morbidity and mortality. If we don't understand whether that pregnancy is going to be a difficult pregnancy and whether the woman will be reaching the last months of her pregnancy healthy, then there's consequences that an event which normally is a very joyful becomes a tragic event. And most of the people, this pregnant woman, they already have 3 or 4 or 5 or sometimes even 9 or 10 children. So when the mother dies and she leaves behind 9 orphans, it's a family tragedy. To provide and to set higher standard of knowledge and competence of health personnel, of maternal and child health. And the issue that today we are sitting here, all the representatives of the university, the hospital, group hospital, the doctors, the maternal and child health staff, and the student of the university is very important, because we are trying to connect from the basic health services to the higher level in everywhere in the country. So this is a pilot project, and if we succeed and we see that what's the outcome of this project is something in which we can use as a model to see what health reform could we do. To provide extensive renovation to the maternal and child health buildings, to boost their reception and give dignity to institutional activities. When I came here 5 years ago, I visited several maternal and child health centers. What happened is that when I see the place that the people are working, which is not a dignity place, the maternal and child health centers are working day and night, and they do a very important work. The people, when they need help, they go first to the maternal and child health centers, most of them. And then when they cannot handle the cases, they send it to the general hospital. So when the people are working, they need a very clean, hygienic place to work. So we need to have a dignity where our woman is supposed to be delivering, where our children are coming into the world. So what we decide is that we go to these maternal and child health centers and we try to understand what is the need What do they need? Do they need that we bring them materials? Do we need to build it and make marmar to all of the place? Do we need to paint it? Do we need a light? What can make a place look like a hospital in which the people can come and ask assistance? And the people who are giving the assistance can work a very dignified place. In order to achieve the first objectives that we talk about, we have chosen a high-profile Somali medical doctors from the diaspora, a resident professional personnel in Somaliland, to organize the advanced training course in neonatal, pediatric, obstetrical, and gynecological emergencies, which is what we are presenting today. So there is a lot of activities going on to utilize the diaspora population, the Somali people living abroad. These people, some of them are working in institutions in the countries that they are working. There is also Somali health professionals. Somaliland have got a lot of professionals in Hargeisa, for example. And what we need is to connect the people working in the institutions in the country that they are living now with the people and the professionals living in Somaliland. The modular training course will be offered to 20 midwives, nurses, and traditional birth attendants, 5 staff members for each MCH selected. As a basic practical clinical course, 12 medical students, last year medical students, and internship medical doctors from the Faculty of Medicine of University of Hargeisa will also attend the course. People were asking me, why do you need to mix it, the students, the university students, the doctors, to the midwives and nurses? The issue is that the midwives and nurses are helping the population. The doctors are coming out of the university trained, and what we need is to connect our staff, whether they are a higher level or whether they are the people who are serving the population. And I think the students will learn something from the staff of the maternal and child health centers. The maternal and child health centers will learn something from the university graduates and the doctors. The presence of medical students as trainees is proposed to encourage a direct exchange of knowledge and experience between the first level frontline health actors and the future physicians in their educational process, a way to facilitate closer professional and personal links between the two essential components of the health sector. The course will combine formal lessons and classroom work. So I'm sure that this course in modern obstetrical and neonatal technique will strongly raise skills of the maternal and child health personnel and young physicians in managing pregnancy-related cases. When the people finish the university, they are very hungry to learn. So what we need is, if, for example, as a volunteers, they can go and work with the health staff in maternal and child health centers, it could be something very important. Because what they need also to know is that the population needs our help. And if we don't brainstorm ourselves to find a way, how can we improve our health issues? How can we improve the dignity of the population? How can we improve the hygiene and the practices? It's very important. Sometimes I hear a lot of organizations talking about breastfeeding. As I remember, our women breastfeeds. They used to always breastfeed for 2 years. So if something is happening, maybe there is a lot of things that we need to think about. Why our women are not breastfeeding anymore? How it come? What's happening? So there are a lot of questions that we need to ask each other. Another component that this project have, and we will try to set it up, is to make some research and see when we are intervening, the 4 MCH, that we will make the intervention when they have a difficulty cases. They will be recording these difficulty cases. And then when they send that difficulty cases to the group hospital and see, not only group hospital, because there is also a private hospital which is helping, There is a Gargar hospital which is offering us some assistance for this project. So what we can do is that to see the cases which goes from the maternal and child health centers which are transferred to the hospital, what happened? What is the outcome? Did the woman survive? Did we try to make survival also the child? If not, what is the cause? Were they delivered sent it to the hospital too late so that there was no early recognition of the difficult cases, or there was no assistance when they come to the hospital? The course consists of 4 modules offered at Hargeisa Group Hospital. Dr. Ubah Farah Ahmed from Rome, pediatrician and specialist in neonatology, conducted a model on neonatal and pediatric emergencies, combining formal lessons, classroom work, and hands-on clinical practice. Dr. Faduma Hashi Iman from Hargeisa Group Hospital, specialist in obstetric and gynecology, conducted a second model on obstetric and gynecological emergencies with the same organizational characteristics as the first model. Dr. Khadija Ali Mahmoud from Rome, specialist in community medicine, taught a third model of only formal lessons on hygiene and public health. The Somaliland Minister of Health ran a fourth model of formal lessons on planning and management of MCH centers. Dr. Khadija Ali Mahmoud, coordinator, made a preliminary assessment at the end of the main phase of the training course. In offering the training course in neonatal, pediatrics, obstetrical, and gynecological emergencies, our intent was not to propose the usual training course as those normally delivered by other organizations. We have wanted to find out if a course completely organized and implemented by Somaliland doctors could start answering 2 questions. The first, can a low-income African country as Somaliland is be considered as any other civilized country in terms of what it may expect from education actions? More specifically, why it should expect an education process at a lower level than that applied to different world areas to train doctors and other health professionals? Can these personnel be trained in the health sector of interest by learning part of the most modern techniques of intervention and not only the traditional ones? The second question was, can this objective be achieved by basing on Somali actors endowed with appropriate professional qualification, sufficient determination, and positive attitude to working in a collective way? As I told you in the opening meeting, the project and the training in particular was also a trial, a sort of pilot experience to find out whether a first positive answer could be given to both questions, and therefore whether the project could be extended to the whole of Hargeisa and afterwards of Somaliland. The experience has still been short, but it and the previous one suggest to me a few simple considerations. The Somaliland professional resources of giving advanced training exist, and the Somaliland first level frontline health personnel, maternal and child health center staffs, as well as young graduates in medicine are willing and capable of going on an advanced course like that we are offering. We have had trainees' high attendance, nearly 100% each day, at both the lectures and the practical workshop, a high performance of lecturers and instructors. These preliminary outcomes indicate that it's realistic to imagine creating in Hargeisa a reference center for neonatal and obstetrical emergencies first, and for the pediatric and gynecological one at a later time. Its mission should be to set standards of knowledge and competence of maternal and child health staff, young graduates in medicine and other health personnel at the most advanced and up-to-date level available in the world. In all fields, but especially in the health area, continuous education is the key to success. Moreover, the center could develop operational functions, immediate advice about what should be done in a specific emergency situation, and at the later evolution stage, direct intervention on the ground to improve the emergency situation in close collaboration with the personnel of the health facilities and institutions involved. Training activities would be advanced and not of median level, as usual in most of the traditional courses administered in African countries. Furthermore, skills for immediate advice and intervention need to be of a higher degree. The person is conducting the center or ensuring the institutional functions must be a high-profile specialist in obstetrics and gynecology and in neonatology and pediatrics. The specialities working and collaborating with the center must know the Somali language and the Somali society. They may be Somali doctors from Somaliland, from Somali diaspora, from other areas of the Somali Horn. They must have the professional qualification required in specific sectors of interest. Particularly for Somaliland specialists from diaspora, they have to be professionals fully integrated in the health institutions of immigration country. This qualified integration is evident of their professional value. It's the opposite of what has been taken into consideration in many times so far. The high qualified Somaliland professionals who we wanted to collaborate with the local institutions must not be at the age of health institutions of the host country, but completely inside those healthcare systems. The center that we are imagining should not be a new structure or separated unit juxtaposed to the Somaliland institution network. On the contrary, it has to be embedded in the Somaliland health system. The center could be based at Hargeisa Group Hospital and managed in part in collaboration with the Faculty of Medicine of University of Hargeisa, and if possible, with the most important component of the private sectors. For example, the Kirkar Hospital, which is helping us now. This is just a proposal to be discussed. We will work for identifying right human resource, financial appropriate support.